Okay, let's unpack this. Picture this. You look at your dog or cat, and you see one or both of their eyes looking red. It's a common sight,
Yeah, it's
right?
good.
Maybe you think, oh, they just got something in it, or maybe rubbed it a bit too hard.
Sure, happens all the time.
But the deep dive we've taken into the material on this topic, well, it makes it really clear. Red eye in our pets is a lot more complex and potentially a lot more serious than it might look.
That's spot on. And what's really crucial, right from the start,
Mm-hmm.
is that red eye. It's not really a diagnosis, not on its own. It's a clinical sign, a symptom you can actually see. It's telling you there's abnormal redness, which usually means blood flow to the tissues around or in the eye has increased. That's called hyperopriemia, or sometimes, there's been actual bleeding.
So our mission today, digging through this stack of articles and research we have, is to guide you through what this red flag really means. We're going to figure out why it happens, how vets actually get to the bottom of it, and importantly, why acting quickly when you see it is just so critical.
Precisely. Because the information really shows us this sign can range from something really minor,
Yes.
easily fixed,
Right.
all the way to something severe that could potentially cost your pet their vision, or even hint at a serious problem somewhere else in their body.
Mm.
The spectrum is just huge.
Right. Let's get into it then. At its most basic level, what is this redness we're seeing?
Fundamentally, it's that visible hyperoemia, increased blood flow, or hemorrhage, bleeding. It could be affecting the eyelids, the tissues lining the eye, the conjunctiva,
Okay.
or the actual vessels of the eye itself.
And what's happening mechanically? Like, why do the vessels actually turn red?
Well, think of it like plumbing, almost.
Mm-hmm.
Those little blood vessels can actively dilate, get bigger and redder. Usually that's a response to inflammation or some kind of irritation. Or they can get passively congested. Like if there's a blockage stopping blood from draining properly, say pressure building up inside the eye.
Ah, okay.
And then, of course, sometimes the vessel just bleeds, leaks blood out, causing a red patch.
Got it. And just confirming, we're talking both dogs and cats here.
Correct. Yeah, both. Now, there might be some specific causes that are more common in one than the other, and we'll touch on that.
Sure.
But the basic mechanisms, the diagnostic approach, it applies to both. Though the specific history and the other signs you see will definitely vary based on the underlying cause.
Okay, here's where, honestly, it got really interesting for me looking through this stuff. It was a bit of an aha moment.
Yeah.
Not all redness looks the same, does it?
No, absolutely not.
And figuring out which vessels are red gives a huge clue about where the problem might be hiding.
This is fundamental, yeah. Vets, especially ophthalmologists, look really closely at the pattern of those vessels. You got what we call superficial vessels or conjunctival vessels.
Okay, superficial. What do those look like?
If you look close, they're typically small, they look kind of wiggly, tortuous, we say, and they're usually a bright red.
Bright red, wiggly. Got it.
And a key thing, they seem to start way back, near where the conjunctiva folds behind the eyelid, the fornix. And they tend to branch out a lot, over and over. Oh, and they move if you gently try to slide the conjunctiva.
So seeing that pattern, that suggests the problem is right there on the surface.
Exactly. It points towards things like, conjunctivitis, or maybe a superficial keratitis.
Okay.
And here's a neat little diagnostic trick.
Oh.
These superficial vessels, they'll blanch, meaning they whiten or disappear pretty quickly, when a vet puts in a specific eye drop, a vasoconstrictor like phenylephrine.
Wow. Okay. So that simple test helps tell them apart. What about the other type then?
Then you have the deep vessels, or episcleral vessels. These look quite different.
How so?
They're generally bigger, they look much straighter, and the color is usually a darker red, sometimes almost purplish. And they seem to start closer to the limbus. That's the edge where the clear cornea meets the white sclera. They branch less often. And importantly, they do not move if you try to shift the conjunctiva.
And seeing those suggests something deeper.
Precisely. These deep vessels often get engorged when there's inflammation inside the eye, like uveitis, or when the pressure inside the eye is really high, like in glaucoma.
Ah, okay, the serious stuff.
Often, yeah. And unlike the superficial ones, these blanch really slowly, or maybe hardly at all, with those vasoconstrictor drops.
So that simple blanching test is actually a really crucial first step. Helps localize things.
Huge clue, yeah.
Fascinating. Okay, superficial, bright red, easy to blanch, versus deep, darker red, hard to blanch. Is there like a third pattern?
Yes, there is. And it looks quite different again. It's called subconjunctival hemorrhage.
Okay.
This isn't really about engorged vessels. It's actual blood that's leaked under the conjunctiva.
Like a bruise.
exactly like a bruise on the white of the eye. It looks like a solid uniform red patch or smear. Usually doesn't cause pain itself. And because it's leaked blood, obviously, it won't blanch with any drops.
Right.
It can look really dramatic, actually. Often happens from trauma, a bump or something. But sometimes it can signal an underlying bleeding problem.
Okay, so we've got the vessel patterns down. Can we quickly recap the basic reasons these vessels get red or bleed? The mechanism.
Sure. The main drivers are, number one, inflammation. That's the most common reason, causing vasodilation.
Yeah.
Number two, congestion. That's when drainage is impaired, so blood backs up. Think high eye pressure, or maybe something pushing on the vessels.
Like a blockage.
Kinda, yeah? And number three, hemorrhage. Just outright bleeding from a vessel.
Inflammation, congestion, hemorrhage. Got it.
Now that we have the basic plumbing, let's get to the big list, the potential suspects. What conditions can actually cause a red eye? Maybe we can organize it by location, like the sources do. Sounds good. Let's work our way from the outside in. We can start with the eyelid and adnexal issues, stuff around the eye.
Like hairs rubbing the eye. That seems like it would definitely cause redness.
Oh, absolutely. Conditions like entropion, where the eyelid rolls inwards. Yeah, or atopic cilia. Those are hairs actually growing through the eyelid lining, poking the eyeball. Or even just trichiasis, which is normal hairs growing in the wrong direction. All that rubbing causes constant irritation, inflammation, and, yeah, redness.
Makes sense. Any other eyelid things?
Well, there's just general blepharitis, which is simply inflammation of the eyelid itself.
And isn't there one really big eyelid-related cause, especially for chronic red eye?
Yes. A super common one, particularly in
Yeah.
dogs, keratoconjunctivitis sicca, or KCS. Most people just call it dry eye.
Right.
This is where the pet just isn't making enough tears. And tears are vital, for lubrication, cleaning, protection.
Sure.
Without enough tears, the eye gets chronically dry, inflamed, and, yeah, very red. It's a huge cause of persistent redness.
Okay, moving a little deeper. What about the lining tissue, the conjunctiva?
Right, the conjunctiva. And inflammation there, conjunctivitis is probably the single most common reason a pet's eye looks red overall.
Just general inflammation of that lining. What kinds of things cause that?
Oh, lots of things. Could be infectious bacteria, viruses. Feline herpes virus 1 is a really big one in cats, often causing flare-ups.
Ah, I've heard of that.
Yeah. Could be allergic, maybe seasonal pollens, dust mites. Sometimes in young dogs, you see something called follicular conjunctivitis. And then there's just plain irritant conjunctivitis from, dust, smoke, shampoos, that sort of thing.
Okay, next layer in, the clear window at the front, the cornea.
The cornea.
Right.
Problems here are called keratitis, corneal inflammation. This usually causes redness, but often comes with other pretty obvious signs too.
Like what?
Significant pain, so squinting, maybe rubbing at the eye, lots of tearing. And often the cornea itself looks cloudy or hazy, kind of bluish. That's edema or swelling.
And what's a really common painful corneal reason for red eye?
Corneal ulceration, definitely. This is basically a sore, a defect on the surface of the cornea.
Like a scrape.
Kind of, yeah. Or it can be deeper. It's typically very painful.
Yeah.
And the key test, the absolute must-do test, is that fluorescein stain. It makes the ulcer glow bright green under a special light.
Okay, ulcers. Any other corneal issues?
Sure. You can get infectious keratitis, bacterial, fungal, or again, those FHV1 herpes ulcers in cats. Those can be really nasty. And then there's some chronic conditions too, like pannus, which is common in German Shepherds, or pigmentary keratitis. These cause ongoing redness and sometimes scarring or pigment changes.
Now, the information we looked at really seemed to highlight a shift when we talk about problems inside the eye. These tend to be more serious.
Generally, yes. These often need more urgent attention. We're talking about intraocular issues.
Okay.
And a big one here is uveitis. That's inflammation of the uveitis, the inside structures like the iris, the colored part, and the ciliary body behind it.
So if it's uveitis causing the red eye, what does that redness look like, and what other signs might we see?
The redness pattern is typically that deeper kind we talked about, that paralimbal redness, sometimes called a ciliary flush.
Right, the darker, straighter vessels near the cornea.
Exactly. Other classic signs. Often the pupil is small, constricted. We call that miosis. You might see what's called aqueous flare. Looks like haziness or tiny specks floating in the fluid in the front part of the eye.
Like headlights in fog.
That's a great analogy.
Ah.
Yeah. Plus, there's usually pain, sensitivity to light. And often, the intraocular pressure, the IOP, is actually low.
Low pressure with uveitis. Interesting. What causes it?
Oh, the list is long. Trauma, systemic infection spreading to the eye, immune system problems, sometimes certain cancers. Or sometimes, honestly, we never find the specific cause. We call that idiopathic.
Wow.
And sometimes you might even see blood in the front chamber that's hyphema or pus, which is hypopion.
Okay, so uveitis often means low IOP. What's the other major, really urgent intraocular cause of red eye? The flip side.
Glaucoma. Absolutely. This is the opposite situation in terms of pressure. It means the intraocular pressure is elevated. High pressure.
And this is the one that's a real emergency.
Full stop. Ocular emergency.
Yeah.
Needs immediate attention.
What does glaucoma look like, besides the redness?
The redness is often that classic deep episcleral injection we describe. Very noticeable.
Okay.
Other signs. Often that blue haze on the cornea, the edema, because fluid is being forced into it. The pupil is usually dilated mydriasis and doesn't react much to light. There's significant pain, often rapid vision loss. And of course, the defining feature, high IOP on testing.
So knowing that uveitis often means low pressure and glaucoma means high pressure, that's a massive clue for the vet.
It's one of the most critical distinctions they need to make right away.
Yeah. What causes glaucoma?
It can be primary, meaning it's usually an inherited problem with how the fluid drains out of the eye. Certain breeds are predisposed, or it can be secondary, meaning it's caused by something else, like chronic uveitis, or if the lens inside the eye pops out of place, lens luxation, or sometimes an intraocular tumor can block drainage.
So those things, lens luxation or tumors, can cause uveitis or secondary glaucoma.
Exactly. They can trigger either problem or sometimes both.
Okay, what about problems happening even deeper, like behind the eyeball itself?
Right. Those fall under orbital disease.
Yeah.
Anything going on in the orbit, the bony socket, if there's swelling or a mass back there, it can push the eye forward.
Bulging out.
Yeah, the term is exophthalmos. And that stretching and pressure can cause secondary redness of the conjunctiva and the episcleral vessels.
What kind of things happen back there, like an infection?
Sure, you can get an orbital cellulitis, which is inflammation, or even an abscess back there. That's usually very sudden, very painful. The eye might not move well, and the pet might have a fever.
Versus something more slow-growing?
Right. An orbital neoplasia, a tumor in the orbit, is typically slower. It gradually pushes the eye forward, maybe deviates it, often less painful, especially at first, compared to an abscess.
And finally,
Yeah.
the sources reminded us that sometimes a red eye isn't just about the eye at all, right? It's a sign of something bigger.
Absolutely. Systemic diseases. Problems elsewhere in the body can manifest in the eye.
Like what?
Well, things like high blood pressure, systemic hypertension. That can cause vessels inside the eye to bleed. Or disorders that affect blood clotting, coagulopathies, can lead to bleeding in or around the eye.
Okay.
And various systemic infections, bacterial, fungal, tick-borne diseases, things like that, can travel to the eye and cause inflammation, like uveitis.
Wow. So that's a huge list of potential suspects, from a simple eyelid irritation all the way to systemic disease or cancer.
It really covers a lot of ground.
Which brings us perfectly to the diagnostic process. How on earth does a vet become an eye detective and sort through all these possibilities?
Yeah, it absolutely has to be a systematic approach. You can't just guess. It really starts the moment you call the clinic or walk in the door with the history.
So, as the pet owner, what kind of details are really crucial for me to think about and tell the vet?
Okay, good question. Think about the onset. Was it sudden? Like, fine yesterday, red eye today. Or has it been brewing, getting gradually worse over days or weeks?
Okay, sudden versus gradual.
Huge difference. Is it just one eye unilateral or both eyes bilateral? Again, points towards different causes.
One eye or both. Got it.
Have you noticed any other eye signs? Discharge? What color? Squinting? Rubbing at the face? And really important,
Right.
any other signs? Lethargy, not eating, fever, vomiting, anything unusual systemically?
Okay, other body signs too.
Definitely. And knowing the breed is always helpful too, because some breeds are just prone to certain eye conditions.
Right. Okay, so I've given the best history I can. What happens during the actual exam?
The ophthalmic exam itself is a really thorough visual inspection. The vet will start just by looking from a distance. Is the face symmetrical? Are the eyelids held normally? Any obvious discharge?
Stripping back first.
Yeah. Then they get up close, look carefully at the eyelids, the conjunctiva. They'll often gently avert the eyelids, flick them out a bit to look underneath for foreign bodies or inflammation back there.
Checking hidden spots.
Exactly.
Yeah.
Then examine the cornea. Is it clear? Are there vessels growing onto it? Any defects? Check the anterior chamber, that space behind the cornea, looking for that flare or blood or pus. Check the pupil size, shape, how it reacts to light. Look at the lens. Is it clear? Is it in the right place? And if they can see through all that, they'll try to look at the very back of the eye, the fundus, with an ophthalmoscope.
That's a lot to look at.
It is a very systematic process.
And after that visual exam, then come the essential tests, the source is basically called non-negotiable.
Exactly. These 3 tests are fundamental for pretty much any unexplained red eye. First, the Schirmer tear test, or STT.
Okay, STT, what's that for again?
It measures tear production. Uses a little paper strip tucked under the eyelid. It's essential for diagnosing KCS, that dry eye condition we talked about.
Right.
And crucially, it has to be done before any other drops or stains are put in the eye, because those could totally mess up the result.
STT first. Got it. What's next?
Next up is the fluorescein stain test. This uses a special orange dye.
The one that glows green.
That's the one. It glows bright green under a blue light, but only where the very top layer of the cornea, the epithelium, is missing. So it sticks to corneal ulcers.
Uh-huh. Finds the sores.
Finds the sores. And this test has to be done after the STT. And here's that critical warning again.
Let me guess.
Steroids.
You got it. If that stain test is positive, meaning there is an ulcer, then absolutely no topical corticosteroid should be used in that eye. Ever.
Why is that so bad?
Steroids suppress the local immune response and healing. They can stop an ulcer from healing, allow it to get infected, or even cause it to melt right through the cornea. It can be catastrophic. Wow. Okay, noted. No steroids with a positive stain. What's the third must-do test?
Tonometry. This measures the intraocular pressure, the IOP.
The pressure inside the eye.
Exactly. This is non-negotiable. Every single patient with an unexplained red eye needs their pressure checked. You just have to do it.
Why is it so vital?
Because, as we discussed, a high IOP is the defining sign of glaucoma. It confirms that diagnosis. And a significantly low IOP strongly points towards anterior uveitis. It's often the key piece of the puzzle.
High-pressure glaucoma, low-pressure uveitis, huge difference.
Massive difference in treatment and urgency.
So history, thorough exam, STT, fluorescein, and tonometry. That sounds like a really solid initial workup. Are there other tests vets might need sometimes?
Oh, definitely. Depending on what those first steps show, yeah. They might take a sample of discharge or scrape an ulcer very gently for cytology, looking at the cells under a microscope or culture to see if bacteria grow.
Define infection.
Right. Or they might run PCR tests for specific viruses like feline herpes virus in cats. If the cornea or something else is too cloudy to see inside the eye properly.
Like with severe uveitis or blood?
Exactly. Then an ocular ultrasound can be really helpful to see the structures inside. And of course, if they suspect a systemic problem, or maybe an orbital issue.
Right, the whole body stuff or behind the eye.
Then they'll likely recommend systemic diagnostics. Things like blood work, checking blood pressure, specific tests for infectious diseases, or advanced imaging like a CT scan or MRI of the head, especially for orbital problems.
Okay, so the vet has done all this detective work. They've pinpointed the cause. How do they actually treat it?
Well, the absolute golden rule here, it's simple but paramount, is that treatment depends entirely on the specific underlying cause.
Can't just treat the redness.
Nope. You have to treat why the eye is red. Addressing the root cause is everything.
What are some of the general goals, though? Things they're usually trying to achieve?
Generally, yeah, several things. Managing pain is often a big one. Red eyes frequently hurt.
Makes sense.
Controlling inflammation is key for many conditions. Controlling any infection, obviously, if one is present. And if it's glaucoma, then aggressively lowering that intraocular pressure is the immediate top priority.
And usually involves eye drops.
Often, yeah. Most treatments involve topical medications, eye drops, or ointments. Sometimes systemic meds, pills, or injections are needed too. And don't forget the e-collar.
The cone of shame.
The cone of shame, but really the cone of healing. It's often essential to stop the pet from rubbing or scratching the eye and making things way worse.
Good point. And just to circle back one more time on that really crucial warning about steroids.
Yes, it absolutely bears repeating. If there's a positive fluorescein stain, meaning an ulcer is present, topical corticosteroids are contraindicated, full stop. They can seriously delay healing or even make the ulcer rupture.
And what about steroid pills?
Even systemic steroids, pills, or injections are usually avoided until any potential infectious causes, either in the eye or systemically, have been ruled out or are being treated. Don't want to suppress the immune system if there's an infection brewing.
Makes total sense. Can you give us just a couple of quick examples of how treatment really changes based on the diagnosis?
Sure. So say it's a simple bacterial conjunctivitis or a tiny superficial ulcer. Topical antibiotics might be all that's needed.
Okay.
If it's dry eye, KCS, then treatment is usually lifelong topical meds to stimulate tears, lubricate, and maybe control inflammation. Things like cyclosporine or tacrolimus.
Lifelong, wow.
Often, yeah, uveitis.
Yeah.
That needs potent anti-inflammatories.
Mm.
Often topical steroids if there's no ulcer, maybe atropine drops to dilate the pupil and ease pain, and sometimes systemic anti-inflammatories too, plus pain meds.
And glaucoma, the emergent.
Glaucoma requires immediate, aggressive treatment to lower that pressure fast. Usually multiple types of eye drops working in different ways, sometimes intravenous drugs in the hospital. And often, surgery is recommended fairly quickly too, especially for primary glaucoma. Deep ulcers might also need surgery, like a graft. So, you see, completely tailored.
Absolutely. Okay, finally, looking down the road, what's the prognosis generally like for red eye? And what are the real dangers, the potential problems, if it's not diagnosed and treated properly?
Yeah, the outcome, the prognosis, it varies hugely. It completely depends on what the actual cause is, how severe it is, how quickly it was diagnosed, and how effectively it was treated.
So some causes have a much better outlook than others. Seems logical.
Definitely. Simple bacterial conjunctivitis or a minor superficial ulcer that's caught early and treated right, usually a very good prognosis, full recovery.
That's good news.
But then you have conditions like KCS, dry eye. The prognosis for comfort might be good with lifelong treatment, but it's rarely cured. Chronic uveitis can be tricky, prone to flare-ups and complications, so the prognosis is often more guarded.
And the really serious ones we talked about, glaucoma, deep ulcers.
Yeah, this is where the prognosis can unfortunately be guarded, or even poor, especially for vision. Acute primary glaucoma is way up there. It can cause permanent blindness incredibly fast, sometimes within hours or just a couple of days, if that pressure isn't brought down immediately.
That fast, wow.
That fast. Irreversible damage to the optic nerve. Deep corneal ulcers, especially melting ones that are rapidly progressing, can be very challenging to save the eye. Severe, uncontrolled uveitis can lead to lots of secondary problems. And obviously, intraocular or orbital tumors often carry a poor prognosis.
So what are the worst case scenarios, the big complications the sources warn about if things go wrong or aren't treated?
Well, the biggest fear is vision loss, ranging from partial impairment to complete permanent blindness. Sometimes the eye just becomes so damaged or painful that it can't be saved,
Yeah.
and surgical removal loss of the eye itself, enucleation becomes necessary.
That's tough.
It is. Other things.
Yeah.
You can get permanent corneal scarring or pigmentation that clouds vision.
Yeah.
A corneal ulcer can actually perforate, burst right through the cornea. That's another emergency.
Yikes.
A really devastating complication is secondary glaucoma. This can develop as a result of chronic uveitis or lens luxation or tumors. So you get the high pressure problem on top of the original issue. Very difficult.
Wow.
And then there's cataract formation, chronic ongoing pain,
Yeah.
and just the frustration of the problem recurring again and again.
So bringing it all back home then, for you, the listener, seeing that red eye in your dog or cat, what's the absolute bottom line, the main takeaway from all this information?
I think the key message really is that red eye isn't just a little irritation you can ignore or, just wait and see about for a few days.
Right, don't just watch it.
Exactly, because that list of possible causes includes so many potentially serious vision-threatening conditions. It really truly warrants getting it checked out by a vet promptly.
And knowing about that whole systematic approach, the vet takes the history, the careful exam, and especially why they absolutely have to do those core tests, the STT, the stain, the pressure check.
Yeah.
It helps you understand they're not just looking at the redness, they're doing crucial detective work.
They have to find the specific why, because finding that precise underlying cause is the only way to figure out the right treatment. And getting the right treatment started quickly is what gives your pet the very best chance for keeping their vision and being comfortable. So next time you happen to notice that redness in your pet's eye, maybe just a little bit, maybe a lot, you'll now have this whole framework in your mind. You'll understand the different types of redness, that huge list of potential suspects from eyelids to inside the eye, and why those tests the vet does are so critical. Hopefully it really helps you appreciate why a prompt and thorough veterinary investigation into this common sign is just so incredibly important for your furry friend's health.